Hello everyone, I'm Dr. Chidzani Mbenge, also known as Dr. Chi. I'm a public health medicine resident at the University of Botswana. I am one individual who's passionate about people empowerment, community development, and the health and well-being of the society as a whole. By saying that I'm a public health medicine resident, I mean that I am currently specializing in public health medicine. Prior to that, I did my medical training at the University of Melbourne in Australia, and then I came back to South Botswana and I worked as a medical officer for 2 years at Nyangago Referral Hospital in Francistown, and then got transferred to Reikops Primary Hospital for another 2 years in Reikops before joining the University of Botswana doing my master's in medicine, public health medicine. Public health medicine is a branch of medicine that deals with the control and management of diseases or health-related events at population level rather than at individual patient level. As a public health specialist, I consider the whole population as my patient, because we deal with interventions that affects the whole population. For example, we deal with the control and management of disease outbreaks like diarrheal outbreaks and the COVID-19 pandemic. We also, roll out things like vaccination programs so that we can eliminate or eradicate vaccine preventable illnesses. The disciplines that we cover under public health medicine residency include epidemiology, health research, health system strengthening, healthcare management, health policy development, and also environmental health. So we do not only consider the biological effects of diseases on the body, but we look at all the other external factors that influences the health and wellness of the community. So we look at the behavioral factors of people. For example, with HIV, there are behavioral factors that encourage the spread of HIV, like inconsistent use of condoms or having multiple concurrent partners. So we look at those behaviors of people and come up with behavioral change intervention backed up by behavioral science theory, to say that how can we effect change within communities. We also look at environmental factors that can influence diseases. This include like the quality of air that we breathe in, putting all those non-smoking zones policies in place so that we ensure that people don't, suffer from secondary smoking or secondhand smoking. So we also look at environmental things like the quality of water that we drink, the quality of food, or the nutritious status of the food that we eat. So during residency training, we are placed in different programs that are potential places that we can be attached to when we complete training. These areas include district health management team, hospitals shadowing the hospital superintendent, and some of the disease control programs of the ministry that are available, including your communicable and non-communicable diseases, sexual reproductive health and maternal health, and also child health. What's unique about the public health medicine residency at the University of Botswana is that we also have the occupational health element aspect of things, which deals with the health and well-being of and safety of employees in workplaces. Following the theory that we do, we also get like 6 months placement at occupational places. Like currently we only do Botswana, so we get placed at Orapa or Chidzani mine. Because of the robust and the broad training that we receive during public health medicine residency, it means that we can find public health specialists under different roles in the healthcare system. At the Ministry of Health, public health specialists are placed at the programs as program leads or as technical advisors in the program. You can also find public health specialists at director level and even as consultants in the ministry. When we go down to the district, there are public health specialists in the district health management team or even as coordinators of the district. During training, we also do hospital management, so you can find public health specialists as hospital superintendents. We are not only limited to work for the government, so we can work for the private sector or non-governmental organizations as technical advisors and also as consultants, going as far as working for international organizations, including United Nations agencies and the World Health Organization. Some colleagues are also working in the academic and the research space, because in public health medicine, we preach research, we preach evidence-based practices, and that can only come from doing research. We are excited to be launching the Botswana Public Health Institute, which will be the Center of Disease Control for Botswana, that will be responsible for robust surveillance and also emergency preparedness to ensure that Botswana is also always ready for any disease outbreak. So right now we have one of our own working as the executive director. So those are potential working areas as well to have a role to play in the Botswana Public Health Institute. Like many high achievers in Botswana, I often say medicine chose me. But at the end of the day, with public health medicine, I'm the one who made that choice to pursue specialty training in public health medicine. When I came back from Australia from my undergraduate medical studies, I used to think that I'll go for the HIV route. But as a young medical officer working in Botswana, I realized that there has been an epidemic shift where we are seeing the rise in non-communicable diseases. There were a lot of patients admitted with hypertension and diabetic complications in Nyangagwe. And as I went to work in Registrar Primary Hospital, I realized that, most people were presenting with late complication or late diagnosis of all these non-communicable diseases. And that showed that there is a gap in the primary care and in the preventive services in our country. And combining my love for research and my love for numbers, I thought that my pursuing a career in public health medicine would be very much ideal, and here I am. The highlight of my training so far has been the attachment at the Ministry of Health. By being there, I get the privilege of attending some of the high-level meetings that goes around, and I appreciate the background work that goes around in running a complex system such as the healthcare system. The COVID-19 pandemic, it brought an opportunity to put public health theory into practice. I was at the ministry at the time when the pandemic broke, and I got the opportunity to become a member of the contact tracing team, the national contact tracing team. My team and I were tasked with developing contact tracing, the strategy, the guidelines, and also capacity building of healthcare workers across the country to become contact tracers. We were the team that contact traced for some of the first few cases of COVID-19 that were imported into Botswana. By being part of the national epidemic response, I got to really appreciate the whole politics that goes around in decision making and public health. I realized that, when you are a public health specialist, you're going to have to make decisions that won't be popular with everyone in the community, but every decision that you make should be evidence-based and it should be for public good. Some decisions that were taken during COVID-19 include, the closure of borders, the quarantines, the isolation, vaccination, and there were some people who did not really understand why those decisions have to be made. But the decision have to be made to limit the effects of COVID-19 in the country. It is equally as important to, educate the community during an epidemic response, so that they understand why some of those difficult decisions have to be made. For me, the future is filled with endless possibilities because of the broad training that we received during public health medicine residency. I'm on my final year of residency, And from here, I'll be placed either as a public health specialist at the district or at the ministry at program level. My interests mainly lie in epidemiology, health system strengthening, and the prevention and control of non-communicable diseases. I also developed an interest in emergency preparedness and response when I took part in the COVID-19 pandemic national response. Further down the line, I would like to become a public health consultant, so I'm considering either doing PhD or a fellowship in one of the public health medicine specialties. I draw inspiration from the likes of Dr. Matshidiso Moeti, who is the current WHO Afro Regional Director, and I also like to have regional and international experience as well. My love for community work means that I like giving back to the community. So I like to own a social enterprise in health that I'll use my knowledge and skills in public health to give back to the community. I will also continue doing some research studies to contribute to the evidence-based interventions that we need in Botswana healthcare system. I would like to see more Botswana doctors and more public health professionals conducting research, collaborating in research, so that all the research studies that we quote for evidence have a local context to them. Thank you so much for hosting me today, and I hope the little that I've shared in terms of public health medicine and what the job of a public health physician entails had shed some light to everyone around the discipline of public health medicine. Thank you.
Wow, that was a very informative session by our very own Dr. Mbenge. Thank you very much, Dr. Mbenge, for taking the time out of your busy schedule to join us on this quest of simplifying medicine. To our viewers, thank you very much for taking the time to watch these videos. If you happen to have any questions, please go ahead and leave them in our comment section below or on our Facebook page. The link to our Facebook page is in the description bar below. For more information regarding upcoming videos, please go ahead and subscribe to our YouTube channel and follow our Facebook page. Until next time, thank you. Bye-bye.